everyone, I'm Dr. Swati, one of the mentors in Study Medic. So in this YouTube series for part 3, we are taking up most important exam tested stations from each of the modules. So this video is basically related to early pregnancy module, and the station which we have picked up is pertaining to molar pregnancy. Now this is a simulated patient task in which I'll be having a role player. I will be the candidate who will be performing the station in the 10 minutes time. And Dr. Soumya will be and Dr. Neha will be my examiner, and she will be evaluating me and giving me marks and basically telling me what well I have done and what should I need to, or what do I need to improve. So let's start with the station. In the 2 minutes reading time, I'll be taking up to read and then perform in the 10 minutes time. Now there are 2 slides with me. These are the reports. Just a minute. Put on my charger. All right. So my 10 minutes performing time starts now. Hello, I'm Dr. Swati, one of the doctors in the emergency today. Are you Leslie?
Yeah, hi. Yes, I'm Leslie.
Hi. Can I confirm your age, please?
Yeah, I'm 32-year-old.
Okay, Leslie, I see that you have come to emergency and you are into your early pregnancy and you are in a lot of distress. Can I ask my nurse to administer you some relief medications, or are you okay to talk?
No, they gave me something, some drip on the injections, but I'm still
All right.
puking very badly. So I hope you'll be able to help me. As well, they got a scan and I'm not sure, but they said you will be telling me about it.
Yeah, I have got your reports as well, Leslie. And can I take your permission to ask you a few questions just to know more about you? And then I'll go on to explain the reports to you as well as formulate a management plan so that we can go ahead. Is it okay, Leslie?
Yeah, that should be fine.
All right. So first, can you tell me more in your own words regarding your problem, Leslie, which you are facing right now?
Okay, so the thing is, this is my second pregnancy, and the first one also I had vomiting, so but that was fine. But this one is really, really terrible because I think from last 1 week I have got this excessive vomiting. I took some medications. I went to my GP, but nothing of use, and I had to, really, really come down yesterday because I was puking a lot, and I'm really not sure because this is very unusual for me, and of course, I tried drinking and eating, but nothing is going inside.
Oh, I see, Leslie. It must be really problematic for you. We'll try to help you in every possible manner. So, can you tell me more whether you are passing urine or not?
Yeah, I think that's fine. Even though it is little high colored, but I think that's fine.
Okay. Did you have any spotting or bleeding from down below?
Yeah, a bit of a spotting, probably like around 3 days
Did you
before.
pass any abnormal tissue or any grape-like tissue, I would say, no?
No.
Okay. Any lower tummy pain?
I have got some discomfort. I wouldn't say a pain, but yes, I've got some discomfort.
All right. So, when were your last periods, Leslie?
I think that must be 7 weeks before.
All right. So, and were your periods regular?
Yeah, before,
And
yes.
all right. Okay. So, can you tell me whether it was a planned pregnancy or not?
Actually, no, but I'm happy to continue.
Okay. That's good. But yes, can you tell me more about your previous pregnancy?
My previous pregnancy was normal, and I had a very smooth normal delivery. And Tim is around 3 years old. He's doing really good, and I didn't have any issues.
All right, great to know that. And are you visiting your GP for any other medical condition?
No, I'm generally fit and fine.
All right. Are you taking right now any medications?
Yeah, folic acid.
All right. Any medications for vomiting? Did your GP prescribe you?
No, I tried something like ginger and the acupuncture and all that, but nothing is
Okay.
working.
Okay, I see. And did you undergo any surgeries on your tummy or down below?
No,
Any family history of concern which I need to know?
no,
All right. Any allergies to any medications or any substance?
no, nothing.
All right. Sorry to ask, do you smoke or drink, Leslie?
I used to, but not in pregnancy. I've stopped like once I knew that I'm pregnant.
Great. I appreciate you for that, Leslie. And whom do you live with?
I live with my partner. He's quite supportive and he's also happy about the pregnancy.
Great to know that, Leslie. Okay, can you tell me about your blood group? Are you aware of it?
I think it's B negative.
Okay, B negative. So did you receive any anti-D injections, any injections named anti-D in your previous pregnancy?
Yes, I think Tim's blood group is AB positive, so that's the reason they said to me that I need to take. Yeah.
All right, yeah. So that's fine. That's fine. So let's proceed with the reports and your further management, Leslie.
Mhm.
Actually, I need to tell you that there is something concerning in your reports. And
Oh my God, is everything all right?
actually, Leslie, yes, I need to tell you more about the reports and management. So do you need anyone to sit with you or?
No, please go on, doctor, because nobody else has accompanied me, so I'm okay. Please go on.
Okay, so Leslie, actually, your scan reports don't show a healthy baby. They show something which is known as molar pregnancy. Are you aware of this term?
No, no.
Actually, molar pregnancy happens when the fertilized egg doesn't grow into a healthy baby, but it grows into some afterbirth tissue, which usually doesn't result in a healthy pregnancy. But it keeps on growing in your womb. So it forms a tissue type of material, which can be of two types. It might be complete mole, where we do not have any baby tissue at all, or it may be partial mole, in which there is some baby tissue, but usually we can't get a healthy baby.
I really don't understand this. I'm pregnant, and you say that I don't have a baby inside. So what I got at this is not a normal pregnancy. So that means to say I might not be able to continue. Is that what you're trying to tell
Yeah.
me?
Yeah, I'm very sorry to say, Leslie, but yes, because we need to get rid of this pregnancy tissue because it won't result in a healthy baby.
Oh, okay. But can I ask you something? Can I take the tablets to uh, get the pregnancy out? Because I'm literally scared if the side.
Scan report situation, that is, we need to clear out the tissue, pregnancy tissue, through surgical manner. Means we need to shift you to operation theater. We need to give you anesthesia, that is, we need to sedate you, and then
Oh,
by giving you pain relief, we might need to, because that will be safer for you, surgical evacuation.
okay. But why not tablets? It won't remove all the pregnancy tissue.
Yeah,
What?
actually, yes, Leslie, because there are risks with the tablets. You might end up having very heavy bleeding, and we might end up that pregnancy tissue might remain inside your womb, and that would be that might be sometimes life-threatening.
Oh, okay. So when should I do this? Can I come back like after a few days, or should I get this done as quickly as possible?
I would recommend to get it done as quickly as possible because this is the reason. Coming to your blood reports, I would also like to explain a bit because you
Mhm,
are actually quite dehydrated now. And
mhm.
whenever there is molar pregnancy, your beta HCG levels, that is the pregnancy hormone levels, become very, very high. And because of this, only you land up having excessive vomiting. And your reports are also showing that your electrolytes, that is sodium, potassium, all are getting quite disturbed. You are having ketones in your urine, and your blood is becoming also towards concentrated side, and it is also affecting your thyroid hormone levels. All these are related to your excessive pregnancy means excessive pregnancy hormone, excessive vomiting, and hence dehydration. So I would recommend to get this done as soon as possible.
So does that mean that I should get admitted now?
Yeah. I would
Okay.
recommend further, our action plan will be to admit you, give you some IV fluids, that is fluids through your veins, and along with thiamine supplementation, some electrolyte supplementation, and then we will be making some preparations for your operative procedure. We will be sending the blood because we need to secure blood. You might end up having more blood loss as compared to normal
Oh.
procedures. So we need to arrange blood also for you, need to get some further tests done before this procedure. And then this procedure would be done by a senior under with proper protocols, because many precautions have to be taken during this. And after that, we will be giving you anti-D also, safe side, so that if in future no problems can arise. And then the tissue which we will be sending to the for the examination reports for the histopathology. They look in the microscope, confirm whether it is actually molar or not. And then if it comes out to be molar, if it is confirmed to be molar pregnancy, we will be registering you at a GTD center, that is gestational trophoblastic center. Okay.
Okay.
And
Okay.
the more important thing is follow up, because sometimes it might prolong. This condition might prolong, and hence regular follow-ups are very necessary through beta HCG hormones. So that all will be done under GTD center surveillance, and you will be needed to get blood tests or urine tests, every 1 to 2 weeks to see whether beta HCG levels are coming down or not. And then we expect this to come down within 8 weeks of the procedure. And during this, we will also ensure that you don't get pregnant, use appropriate contraception techniques, either pills or barrier contraceptives. Were you on any contraceptives before, Leslie?
Yeah, I'm very comfortable with the pills because that's what I was taking. So I hope I can
Okay.
continue to take.
Okay. So we will be, you can use pills safely. We will be arranging for contraception services also after this. Okay, so that you can get in touch with the contraception specialist. And because, it will interfere. If you get pregnant in between, it will interfere with the follow-up.
Okay.
And
So,
yeah.
okay. So, what about my, I'm not sure, like, so when can I try for the next pregnancy?
Yeah, I would suggest that when your beta HCG levels come down and to the natural levels, that is less than 20 or less than 15, and then for further 6 to 12 months, after that, you can plan your pregnancy safely.
Okay. Can this happen again?
Actually, there are very less chances of happening again, and there are quite great chances of you having a healthy baby in future. But yes, whenever you get pregnant in the future, you have to get early scans so that we can ensure that such thing is not happening again. There are very less chances of it happening again, dear.
Okay. Okay, that's fine. So probably I need to discuss with my partner as well. But as you said
Yeah,
that I need to get admitted, I think because I'm very tired as well, so I'm okay.
I
So
see.
should I be cautious of anything else?
Yes, we will be starting you on fluids right now so that you start feeling well. I know you must be feeling very exhausted, but as soon as we will start you on fluids and medications and all the tests, you will start feeling better. I will also put you in touch with my consultant. He will be coming to see you soon. And I'll be giving you some information leaflets so you can go through the procedure. You can come to know more about this condition, and then we can proceed ahead with the management plan.
Okay. Okay, I think that's fine. Yeah.
Okay, if in case you require something more, you can get in touch with me. Thank you
Sure.
for your time, Leslie.
Thank you. Thank you so much.
Again, I overshot the time. Sorry, examiner.
Yeah, I don't know what to examine you. No,
Perfect.
so all right. So this is the way that we follow. So after the candidate has done with the presentation, usually at the end of 10 minutes, we stop the timer so that the candidate cannot present further. And you have to time yourself so that you finish up the station maximum by 9.5 minutes, so that in exam you have those 30 seconds remaining for the corrections or for the examiner to ask questions. Okay. So always practice in a way that you finish up the station by 9 or 9.5 minutes if you're doing with yourself as the role pair or any of your friends. Okay. First is that. Then secondly, first of all, most of the things were told by you really well. The information gathering was adequate and crisp. You acknowledged the condition that she had come with. You offered her help and support, and you gave the necessary medications to settle her down her condition. And after that, you have taken well into consideration the previous pregnancy outcomes, then the examination was done, the management part was done really well. Only there are a few points that really I wish that you could have involved. First of all, whenever you are starting off with the station, you are saying that I ask the nurse to administer you some fluids. So rather than using those terms, you can just use the term give, right? That we can ask the nurse to give you some medications. May I know, are you allergic to any medications? Although you asked the allergic part, but before administering also, we need to rule out allergies in the first place, because the patient might say in exam that, yes, I need something, right?
Yeah.
So
Yeah.
that would be a very patient safety point, that negative marking for you.
Yeah.
Secondly, you asked about the RH negative pregnancy. Then you did not ask about the Jehovah's Witness, because in such situations, we definitely, expect a lot of blood loss. That's the only reason why the ultrasound guided DNC you had to advise with the consultant support and the anesthesia support, along with the hematologist, along with the blood products. And for that, Jehovah's Witness asking is for utmost important in the patient safety point. Okay.
Right.
The complications like would have been asking about any breathlessness, so that we rule out any of the end organ damage, ARDS or DIC or any DVT in that situation, because you said that the blood will become like thicker or something like that.
Yeah.
Okay. When you discussed the reports of the patient, before that you should examine the patient again to check the vital parameters of the patient, although you are having all the reports. But then also you have to say that my nurse would be quickly checking your blood pressure, your pulse, to see how well you are doing right now. And gently I'll be seeing your a lower down opening or the mouth of the womb, to see for any vesicles or the bleeding and the amount of the bleeding.
Right.
That way. And after that, when you're discussing the reports, you forgot to mention about the name, age, and NHS number. So you had to confirm the patient identity as well, right? Here you explained about the ultrasound findings, but you have all the findings, right? So the later on you explained about the blood and the urine, but then at the outset only you could have said, like, all the examination findings are there with me, all the blood and the urine reports are available with me, and the ultrasound reports are also available with me. So can I know if anyone is there with you for the support, right?
Right.
So that could have been a better schematic for scheme for that. And you can just use your pen and paper to draw what exactly is the molar pregnancy.
Yeah,
okay,
that's
because
absolutely essential.
yeah, so you have got the pen and the
Face to
paper
face.
in the exam, so you can just use your pen and the paper. Even if you scribble anything, that will do.
Very essential.
Right. And yes, whenever you are explaining a lot of things together. So just make it very short and simple that, see, this is the womb, this should be the baby like, but some abnormality may happen because of genetic condition or the reasons unknown, because of which the baby does not form, but the afterbirths keep on forming and they become like grape-like vesicles inside. So that's a simple explanation that you can just give.
Right.
After that, you have said that surgical evacuation would be done and anesthesia person would be done. You have to say immediately that, first of all, admission, stabilization of your condition, checking bloods for other things that you wish to do. Okay, or you can get an X-ray done or something like that. Involvement of the MDT was the thing that I was waiting for.
Yeah.
Right. My senior would be there, my anesthetist would be there, the blood bank would be there, and all the team, the high-end team would be there in order to help you and support you through this. First, we will be giving some fluids to your arm, stabilize you. Along with that, we'll be preparing the OT, and then a senior person would come, and definitely we will be evacuating your womb under guidance of the ultrasound. So that we do not we avoid any complications that might happen, like the perforation or the excessive bleeding. Okay. And even if anything is there, I will be taking a detailed consent, and every senior person would be there to deal with that condition also. Right. And after the suction evacuation, then we'll be, sending the products, you said that rightly, and the GTN center referral would be done. Very few % of the cases might become malignant. For that, we need to give some medication which is known as methotrexate. Most of the pregnancies are absolutely fine, and the next pregnancy you will be able to conceive naturally, and there should be no problem for that. Right. So rather than her asking you, what about my next pregnancy? What about my planning of the next pregnancy, the contraception? You just, see admission, stabilization, MDT, suction evacuation, sending the products, and then you can go ahead with the beta HCG monitoring. If it comes out by 8 weeks normalized, then weekly, and then we can just, give the contraception, and that's the end of it in the next pregnancy.
Great.
Okay.
Great. Great.
Yeah. So these are just the points that I mentioned.
Yeah.
For,
Thank you so much, Dr. Neha. Thank you so
You're
much.
welcome.
Thank you, Neha. Thank you for the detailed feedback. Because I'm
Thank you,
the role
ma'am.
player, I think it made it was actually a little difficult for her.
Right.
Otherwise, only thing which I thought you shouldn't miss is two, Jehovah's and VT. Otherwise, it was fine.
Yeah. These two actually, basically, I definitely, deliberately, I didn't ask so that these can be pointed out during the feedbacks.
Yes.
Jehovah's and
So that's the
MDT.
reason I pointed
Huh.
out all the things so that the candidates know what they actually
Yeah.
miss and they don't, ask. So
Yes,
that's the
sometimes
reason
they
I
do miss.
pinpointed. Otherwise, Swati will beat me after this session is done. That
Blood transfusion
Okay.
reservation and MDT, these two deliberately I made so that these
Yes.
two can be pointed out for the candidates.
Yes,
Thanks a
yes,
lot,
because
Neha.
these
Yeah.
guys make a very, these are the
Common mistake.
very simple points where they go wrong. So
Really.
we need to see upon that. Yeah.
Great.
Otherwise,
Otherwise,
well
you
done, Swati.
performed very
Thank you.
nicely. Yes.
Exactly. Well
Complete
done.
pass from our side.
Kind role player. So thanks a lot. Thanks a lot, dear Neha, for the great feedback.
Thank you
And
so
see,
much.
these are the points we do tend to miss in our examinations, either due to lack of time or sometimes under nervousness. So yes, these are the small points which you can easily overcome through practice. So the practice, and practice are the key to success, nothing else. So hope this station was helpful for all of you. Please do take care of all the domains, whichever you are being marked, especially if suppose you are not being marked in information gathering, then don't take very unnecessary detailed history. Okay, emphasize more on communication, patient safety, and applied clinical knowledge. So all the very best. Do practice more and more stations of early pregnancy module because they are very easy and easy to score marks and pass. All the very best. We'll come out with more of the stations. Thanks a lot.